Do I have your permission to record you for my online Doctorate of Athletic Training class, Corrective Exercises for Movement Dysfunction?
Yes.
Perfect. I'll have you lay supine on the table here. To start off today, discussing core stability progressions, first we need to do an assessment. There's not a gold standard for assessment of core stability, so for this particular video, we're going to use a unilateral hip bridge endurance test. You can do a prone plank endurance test, a supine or prone endurance test. There's in the literature, you can look up those two tests. Side plank endurance test. There's also FMS scores, Y balance scores that you can also utilize. And really what you're really looking for is not one test that you're going to use. You want to make sure that you're assessing movement and core stability through all three planes of motion as you go. But again, for the purpose of this video, we're going to just do one assessment. So I'm going to have you bend both knees up here. Good. You're going to cross your arms. And what I'm going to have you do is bridge with both feet until you're parallel or in line. Good. And then once you're in line, I'm going to have you extend one of your legs. Keep your thighs parallel. Good. Here we would start the clock for the test. What I'm looking for is greater than 10 degrees movement in line with the spine in the sagittal plane or the frontal plane. And switch. We've done an assessment prior to this video just to save some time. Good. Come up, and you'll come up on the other side. Make sure you're up. Perfect. All right, first exercise in our progression, we're going to put him in the supine hook lying position. So I'm going to have him bend his knees up here. Good. And we're just going to work on some diaphragmatic breathing. I just want to get a gauge on where he's at. So I'm going to have the patient, good, one hand on your chest there and one hand on your stomach. And I'm just going to have you take 5 breaths in through your nose, out through your mouth. Okay? And we're looking for the how well the diaphragm's working, whether we're getting any lateral expansion, and just kind of looking at any accessory muscle movement, anything like that that we're finding with him. Last one. Good. So for him, he's actually got a lot of extension and kind of a good rib flare here. Sometimes that supine hook lying position can actually extend the lower back a little bit more. So what I'll do sometimes is actually put him, I may regress him into a 90-90 position. Place him on a ledge. In the clinic, this will be set up against the wall, feet against the wall, but for the purpose of this video, we'll just kind of have that. And as you can see here, when I bring them up into the 90-90 position, what I'm doing is bringing this rib and the ASIS closer together, hopefully increasing that abdominal activity a little bit, making it a little bit easier for him to breathe. So what I would have him do is engage his heels into the ledge. It's going to kind of promote a posterior pelvic tilt, and then he would also then perform those 5 breaths again. All right, so in the hook lying position, one thing we can do once they've owned that breath, we can start adding in some movement at the extremities. So one variation I'm going to show you is some upper extremity movement. So I'm going to take a band, place it in each of his hands. I'm going to have him instructed to take a breath, find his core, lock in, good abdominal bracing. And we'll have 5 repetitions with both arms down. Make sure he's normal breathing as he goes through this. If we're worried about him rushing or we think the breath needs a little more focus, pause at the bottom. Give me 1 breath in through your nose, out through your mouth. So pause on this rep. Good, and resume. Good. We can also add in a variation, just one arm stays straight. So let's go right arm up. Let's go right arm up, left arm down. Progressing them from the supine hook lying position, we're actually going to put them into the 90-90 position unsupported. So I'm going to have him bring his knees up to his chest. I'm going to have you raise your arms here, okay? And then we can work on a dead bug variation. We went over this a lot last week in the breathing segment of the class, but this is a great lumbar core stability exercise as well. So different variations that we can have him do. We can actually have him just start in this position, make sure that he can own this position with his breath and with his movement before we actually start moving him. Okay, so the first thing I have you do is I'm going to have you take your right leg. You're going to extend it out. Good. And you'll come back in. And you can alternate that with your legs. Good. We'll do 5 on each side. You're maintaining your breathing pattern as normal. Good. And here I want to make sure that he's not extending through his lumbar spine, making sure that he's not losing his position with his arms, making sure that he's not holding his breath. Any compensations. And a great variation for this exercise, altering the task a little bit, I can bring a med ball up to him. I can have him continue to do this. Make sure you're keeping it 90-90. He can maintain this position and continue to do what he was doing. Holding the med ball, I can have him take the med ball and rock back and forth as he moves his legs. Good, be a good variation. The other thing is he can keep his leg movement going. Maintain here. We can add perturbations into the ball, just kind of altering the task a little bit to, again, challenge the dynamic systems theory model to challenge the sensory motor system. Good, and relax here. If we wanted to alter the environment for this exercise, I could have him lay on a half foam roller. I could put him on an AirX pad. One of the balance beams with the AirX pad would be a great variation for this exercise. Okay. Resuming the 90-90 position, I'm going to have him come here. You're going to raise your arms up. Good. You're going to tuck this right in between you here. Okay. So he's going to maintain that 90-90 position. Hold the ball right here, and then what I'm going to have him do is actually rock as far as he can go to the left, as far as he can go to the right, and maintaining that core stability. Good. Have you do 5 repetitions of that breath. I want you to maintain your normal breathing as you would. Good. Make sure that abdominal is braced, nice and tight. And don't lose your contact with the ball. If we wanted to alter the task for this, again, we could just add more challenging component to this. I could add perturbations to the ball as we're moving and asking him to complete this. We did 5 on each side. Next thing we're going to do, progressing from the 90-90 position, is actually put him into side lying. Okay, so what I'm going to have him do is lay on his side. I'm going to bend your knees up a little bit here, Brett. Place a foam roll here. You can use a towel or anything like this. This is more of just a dissociation drill, just trying to get the upper extremity and the lower extremity kind of coordinated and working opposite of each other while also having to maintain good abdominal bracing, good breath as he goes through. So Brett, you're going to come up here. Arms are going to be extended. I'm going to have you, I want you to leave your legs in this position here, and you're going to rock your upper body. Bring your arms back towards me, and I want your eyes and your head to follow your hands as you come back. Good. I don't want you holding your breath. I want you breathing as you normally would. I want you to perform 5 repetitions in this position. Good. Keep that tight there. A little bit of pressure into the foam roller between your knees would be great. And rock as far as you can back. Okay. Maintain good position. We could perform this bilaterally as well. For the sake of the video and time, we're only going to do on this one side. Good. If I felt comfortable with him owning that position, one thing we could have him do, altering the task again, is to add a weight in his hand. I could give him a kettlebell, I could give him a medicine ball, and make him run through that movement with some sort of resistance. Next thing, taking them from the quadruped position, I'm going to take him up to a 4-point stance. and do a bear crawl variation. So I'm going to have him assume the position for bear crawl. Again, I want neutral spine here. Neck, I don't want it extended, don't want it fully flexed. He's going to maintain this position. And then we're going to ask him to bear crawl. Good, nice and slow. That's just kind of performing through the motion. One thing that I like to do with the bear crawl is before he actually moves, is kind of get him, I'll say pause, and I want you to take 2 breaths in through your nose, out through your mouth. Good. Take a step. Pause. In through your nose, out through your mouth. You can see here I've had him pause with 4 points of contact. The other thing I can do is have him pause as he's in mid-stride, 2 points of contact, and then he can take 2 breaths in that position. Good. Don't lose your stability. Brace. Good. You can do the same thing on the other side. We can have him crawl backwards if we want to. We can add some side crawling to this to get some different planes of motion as we're working through here. But the bear crawl is a very good exercise when you're working through core stability. So. Good. Next thing that we're going to do is kind of put him in a sideline position. To start off for a progression, we'll start him off in the 3-point stance. So we'll have 2 points of contact with his feet and 1 point of contact through the arm. So what we'll have him do is kind of assume a side plank position here. Good, maintaining good neutral spine. Good. Let me go hand on the hip here. Perfect. And then we'll have him ask him to take 5 breaths in through his nose, out through his mouth. Good. Good long exhale. Good. And we're using it's a little bit of subjectivity here, so we're making sure that he's not losing control, core stability as he goes through this. I want to make sure that his neck's not kicking in, make sure that he's maintaining good, proper breathing pattern, hips not falling down, he's not rolling forward, rolling back, pretty much just maintaining good control, good stability as he performs the exercise. Good. Okay. Other thing we have to do, so now from a 3-point, let's take him, go ahead and put him into a 2-point stance. So we'll just stack those right on top of each other. Good. Okay. You'll come up in that same position. What I'm going to do this time is have you raise your arm up over your head. Good. I'm going to hand you this kettlebell and ask you to maintain that position as you come through. And we'll take 5 breaths in this position. Good. And same thing, we're assessing. We don't want him to rock forward, backwards, maintaining good neutral spine as he performs the exercise. Make sure the neck's not taking over and compensating throughout the exercise. It's a pretty static exercise, but very challenging at the same time. So what we'll do now, let's add in a little bit of movement in this position. So you're going to go on that position. You need to switch sides?
No, I'm fine.
Okay. So once you go up in that 2-point stance again. Okay. Good. And you're going to take back here. And I'm actually going to have you bring your knee and your elbow and kind of have them touch together. So you're going to maintain that position. Okay. Good. Good. Okay. So again, another dissociation drill. Just trying to get the upper extremity, lower extremity, everything kind of working together through that core, having to maintain that stability. Good abdominal bracing, and I want you to maintain your breath. Good. Good. You can kind of hear those exhales. Very, very challenging exercise. Another exercise that we can do, putting them in the kneeling position. So we've got 2 points of contact with both knees. And what we're going to do is just a core rollout. So he'll place both hands on the Sorinex roller. You're going to walk all the way out, maintaining good neutral spine, and also normal breath moment. I don't want him to hold his breath as he goes through the moments. We'll do 5 repetitions total. One thing that I like to do with this exercise to kind of alter the task a little bit is as they're in full extension mode, is actually have them pause and make them take 2 or 3 good breaths in through the nose, out through the mouth, good exhale. Make sure they can maintain that position. Very, very challenging. Another exercise that we can do, half kneeling position, is a rotational press. And so what he'll do is we can actually take this, you've probably seen it in your weight room. The weighted bar actually hooks up to your machine weights, and you can actually get some resistance through this. But for the demonstration of this exercise, we'll just use the pole and actually show you exactly how to do that. So again, he's maintained in that half kneeling position. Assuming that we've got the cord hooked up on the side, that's got the leg that's raised. Okay, so this is connecting whether it's a TheraBand resistance or hooked up to your machine weight. So what he's going to do is he's actually going to rotate towards the side with his knee up. Good, keeping his elbow straight. Rotate, let your head go with you. Good. Come back, and then he's going to press with the left arm here. Good, so we would have some resistance hooked up here. So again, rotate again. Good. Coming back, he's got to maintain good neutral spine as he runs through that exercise, maintain normal breathing patterns. I can hear, I'm listening for him to exhale as he's breathing through the movement. Switch it, change the environment, put him on the AirX pad. Good, he can rotate again. Back. Another thing we do, drop him out of the high guard, bring him into a kettlebell, come back, good, squat down, good, extend out, come back, do 5 reps. So just really challenging him in different postures with different tasks in a different environment. Again, in the standing position, one thing that we now want to do is put him in a single leg stance. So we've advanced from 2-legged symmetrical now to asymmetrical, now to single leg stance. So one of the things that we can do, I like to do first in this position, is to assess their single leg squat. So this is one of the assessment tests that we actually could have utilized when we're assessing core stability. So we'll have him actually perform 5 repetitions in a single leg squat. We would normally do this bilaterally. For the sake of the video, we'll just do it on one leg though. So you can see for this patient here particularly, as he goes down the core control hinge, we got a little bit of shaking going on, not much depth with the squat, so he'd be a good candidate for a core stability program.